Okay. All right. So I'm Dr. Emily Wood, and this evening we're going to be talking about one of my favorite treatments and for myself and my patients called Ultherapy. So thank you all for joining. This will be kind of a relaxed night where you all can ask questions and we can answer them and just take a deep dive into this. If you don't mind, just hold your questions for at the end, or you can type them in the little chat box. Then Becca will look at them, and then at the end we can kind of go over them and answer those for you all. But yes, thank you so much for joining. So what are we targeting with Ultherapy? So you see here we have a depiction of a youthful face, and then over time we start to see changes in our collagen, which manifests as jowling, sagging of our neck, hooding of our eyes, as well as lines and wrinkles. And this is all because over time our collagen production decreases. And we lose collagen also because of sun and the environmental stressors on our skin. So this is a nice little microscopic depiction that I think it makes a lot of sense as to why we see the sagging and the drooping. It's because our collagen fibers act as little tent poles holding up our skin. And so you can see this nice little picture of healthy collagen structures. And then over time, as we lose it, there's less tent poles to hold everything up. So if there's a way we can rebuild some of that collagen, then we can restore that youthful, plump, tight look to the skin. And again, things that contribute to this: lifestyle, stress, sun exposure. We live in a very sunny place where our skin just takes a beating from the day-to-day stressors. Um, So we can boost our collagen with Ultherapy. So Ultherapy is a device that uses ultrasound energy to stimulate your body's own natural regenerative collagen response. So that's what I love about it. We're not injecting anything. We're not adding any foreign objects into your skin. This is all your natural collagen response. So you can see here is the little ultrasound probe going over the skin, and then the way it works, we're creating a controlled wound healing response underneath the skin. So we're building new, stronger collagen fibers that appear within 3 to 6 months. The beauty of Ultherapy also is that there is zero downtime. So you can get your Ultherapy treatment, and then that night you can go to dinner. No one has to know you had anything done. So really is a nice treatment for those of us who have just a busy life and schedule. So here is a depiction of the Ultherapy screen. Um, so you can see right up here, this is our nice little ultrasound screen. So just like any other ultrasound, we can see the collagen layers here. So the collagen is white, and everyone's collagen is slightly different. So this allows us to totally customize the treatment to your unique anatomy. Um, and to ensure that we're treating the correct layer, which I will say that technology is not available with all of the other skin tightening devices that are on the market. And so this allows us to treat the level that we want um, for your specific needs. And again, just the beauty of Ultherapy is that it truly is based in science. It works. The studies with Ultherapy, this has been around for a long time. And so it's rooted in true science that is based on wound healing and how we can boost collagen. So this is a really nice little picture here, because when we think about different ways to tighten the skin, there are a lot of different options out there. And, you know, you as a patient are thinking, well, what's right for me? What are my options? What are the differences? So here, on the left, we have facelifts. Okay, so that's always an option. Okay, but this is cutting through tissue, significant downtime. But that's how you reach those deeper layers of tissue for tightening. Then we have our lasers, so Fraxel, CO2 laser, those sorts of things. I do all of that, but those can only go so deep. So those can't tighten deeper layers of collagen. Then we have radio frequency here, which are, that technology is used for skin tightening. It provides sort of a bulk heating of the tissue and it works, but I will say my preference is micro-focused ultrasound because of the visualization. So you can't really customize radio frequency treatments for patients because it's just sort of bulk heating that whole area and you get what you get. But with micro-focused ultrasound or therapy, you can see here, it's very precise layers that we're treating. And so, depending on the exact your anatomy and what we're trying to target, whether it be more superficial wrinkles or deeper skin laxity, we can really customize it how we want. And so that's the beauty of it. But I think this gives a very good view of comparing, different skin tightening devices and procedures. Um, yeah. So what areas do we typically treat with Ultherapy? So, FDA approved are treating the lower face for jowls. We treat the forehead for eye hooding, which one of my personal favorite areas to treat to just give a non-surgical lift for the eyes. You can also treat under the chin for that little loose bit of skin that develops there, as well as along the neck, and then as well as the décolleté or the chest wrinkles. So those are the FDA approved areas. Here again, the lines and wrinkles that form on the décolleté is also an area that we treat. And those form commonly from just, if you're a side sleeper, if you've had significant amount of sun, then Ultherapy can be very helpful for those lines. But there are also a lot of other areas on the body that have been well studied with Ultherapy. And so I treat those as well. So those being skin laxity on the arms, loose skin on the abdomen, the thighs above the knees, as well as the buttocks. And then I also treat a lot of that posterior thigh area. So those are some other great areas to target, and there are quite a bit of research to support its use, although it is not FDA approved, but still works great on the body. So just to give you a little idea of your treatment experience, so what you'll do is you'll come in, we'll take photos, we use topical numbing on your treatment areas, and then we'll use ultrasound imaging to get an idea of what layers we want to treat and how we want to customize your treatment for you. And then depending on the areas, the treatment takes about 30 to 90 minutes. Patients always ask me, what about pain or discomfort? There are a few different ways that we can make it a really great experience for you. So everyone gets topical numbing. And then from there, we have Pronox or laughing gas. You might be familiar with that from a dental procedure. Basically, it just helps your body's pain response so that you don't feel pain from the treatment. And then if you are feeling like you have a lower pain tolerance and want a little extra, we can always coordinate prescription medications that you would just bring to your treatment to make the treatment experience, ideal for you. And so that's not a problem to arrange all of that. And then you just kind of hang out and we have some relaxing music, we dim the lights, and you get your Ultherapy treatment. And then that day, again, at most, you might be a little bit pink, but usually by that evening at dinner time, you look completely normal. And then you just wait for the 3-month mark is when you start to see the improvement. And then again, you'll see even more at 6 months. Again, like no pre and post treatment skincare that you have to do. No downtime. I think that's really key when you're looking at procedures. For me, at least, like I'm very busy. I'm a mom. I don't have time to, have a lot of treatment downtime. So I actually got my old therapy treatment a week ago, and I'm back to work and, looking normal again. So that's really, I would say, a definite pro of Ultherapy is that it does not slow you down. This is a study that I actually conducted on Ultherapy where we were treating patients the lower face and just that little sagging under the chin, that being kind of the most common area we treat. And so we were studying specific customized protocols for patients, which we already do that in clinical practice, but I wanted to publish this so that, I could share it with other doctors. And basically, we saw that patients who have it very customized to their anatomy have a greater improvement in their skin laxity. Another cool thing that we saw was really nice improvement in the jawline contour. I mean, we're all about that nice jawline these days. And we were able to show that without injecting any filler, without any surgical cutting. We saw nice, sharper jawlines with the Ultherapy. So that was a nice point to highlight with this study. And this was published in the Journal of Drugs and Dermatology in 2024 with some of my colleagues in San Diego. So these are some of my patients that we treated in our study. So again, we're focusing on this lower face area. So, and right under here, so this is before and then 6 months after the treatment. So you can see really nice skin tightening here. Her jawline is more defined, and it, overall just better contour of that lower face. This patient also had same areas treated before and then after at 6 months. You see that nice little tightening here, less deep wrinkle here of that marionette line. So great results there. Another one of our lovely patients in our study, and great results here with the neck. You can see here, very much tighter, no surgery, no cutting, no downtime. This is a patient that I treated her buttock and thigh area. So she was just complaining about, having some rippling, mild kind of texture, laxity problems here. And this is before and 6 months after. And then you can see, a smoother buttock. Very pleased, just one treatment. These are really nice close-up shots of the improvement you can expect with hooding of the eyes. So you can see a little hooding here. This is after 70 days. You see a nice lift. Again, same thing here. Just helps open up that eye area and improve that little, bit of skin overhang. Helps with like the makeup going on easier, mascara not, rubbing against your skin. This is a patient I treated her lower face and neck. You can see the skin's much tighter here. She had quite a bit of laxity, and that was with one treatment. Again, necks and that lower under the chin area is honestly my most common area that people complain about. And so she had some laxity there. And then, yeah, I was very pleased with her results, the tightening she achieved. So again, just to kind of summarize what we went through, why should you choose Ultherapy? If you want a treatment that's customized to your individual anatomy, utilizing ultrasound, then this is for you. And I mean, I think why not pick the treatment that's going to be best for your needs? Pinpoint the layers that are going to give you maximal lifting and tightening. And also, it's really nice not to have any downtime. with a procedure that can tighten like this. And so that's also just a good point. Like you can do it anytime. If you have an event coming up, it's fine. If you're going to be in the sun, it's no issue. And it also allows us to target deeper levels of collagen that you really can't get with laser or other devices. So, as a little treat, and just thank you all for joining, I wanted to offer participants 20% off a treatment if you call and book your treatment by Valentine's Day. Um, you will get to take advantage of this. This is honestly the best discount you will get ever at Westlake. It can't be combined with other discounts, but this is just a little treat as a thank you for joining this evening. And then if you have other questions or you need to book, you can book online. I see patients in both Westlake locations and in Marble Falls. We can help you with that. And then if you feel like you want an individual consultation with me, maybe you have more questions, you can reach out and email us, or you can just go ahead and schedule a complimentary consult with myself and we can, go into a deeper dive of what would be best for you. Becca, do we have any questions that we want to go over?
Hi, yes, we have a couple of questions. Someone was wondering if we needed to have a consultation done before they book or what that process looks like.
Yeah, so if you want to do that, I think that is totally fine. We can kind of talk more individualized to your skin and your anatomy. And we're happy to do an in-person consult if you want to do that before you book.
Another question we had was some curiosity about, why does it take so long, that 3 to 6 month window before we start seeing some improvement or some results?
Yeah, I think that's a great question. I will say, any skin tightening procedure that's out there, it's all based in the principles of wound healing, which, if you go look at a textbook that we study in medical school for wound healing, there really is no other way to speed that up. So I would say if anyone is telling you, aside from surgery, that you will get faster results, they're probably lying because the only way to stimulate collagen is to give it time. You have to give it time to build. So that is part of just the very basics of wound healing science, and that is what Ultherapy is doing, is creating a very controlled wound healing response underneath your skin that we can't see with our eyes. And then it's giving you stronger, tighter collagen.
Another question was specific to the neck. How soon do we typically start seeing results at the neck compared to maybe other areas? Or is it possible to start seeing 6 month results at like a 3 month mark?
Yeah, I will say some people have a more robust wound healing response. So sometimes they will see more improvement at 3 months, and someone else you might expect it to take longer. I would say I wouldn't expect a whole lot of improvement before 3 months. Occasionally we'll see a patient that has a little bit of tightening starting at 6 months, but really for all areas on the body, it's kind of that 3 to 6 month window is when you start to see improvement.
We had a couple of questions about how weight loss or weight gain could affect or change the results of Ultherapy.
Yeah, so I mean, we see a lot of patients, these days, the GLP-1 medications are great and they're really helping a lot of people achieve some goals that they've been wanting to for a really long time. And with that, weight loss sometimes can skin laxity then appears. So if you have like a goal weight that you're wanting to get to or something like that, I think it never hurts to maybe just come in and do like an individual consultation with me because that can be very case by case. Sometimes I will say, yes, you should wait, or sometimes it won't be an issue that you need to wait. So that can be more case by case, but that's a very good question.
We had a follow-up question about the wound healing process. Someone was wondering that when the wound healing process is complete, is that when we would start seeing collagen breaking down again?
No, so the cool part about all of this is, okay, you're boosting your collagen. So once you've had one treatment, you're always going to be better off than you were at day zero before your treatment. You're kind of like banking collagen, if that makes sense. Now, we don't live in a bubble, so the aging process, I always tell patients, it's dynamic. It's always occurring. We're always, having the sun beating down on our collagen. So you have to keep up with it. So as far as, when to do it again, for most patients, it's usually an every 1 to 2 year treatment. Like myself, I try to do Ultherapy every 2 years. So I just had mine done. So my collagen's banking and I'll do it again probably in 2 years.
Another question was about if someone already has fillers to their face or somewhere on their body, does Ultherapy have any kind of effect with filler already being in that same area?
Yeah, that's a great question. No, in fact, if you have fillers, it's totally fine. The old therapy is not going to dissolve your fillers. There are actually, several studies to, support its combination use of old therapy with fillers. So if you've had that before, it's totally fine and it's not going to break down your filler.
And then another question about, is there a benefit in taking collagen supplements in addition to collagen stimulating fillers, and how is diet kind of a factor, if it's a factor at all with this?
Yeah. Um, I do think that it is beneficial to take collagen supplements. There have been some studies to support its use. We've never studied Ultherapy in patients taking collagen, but I would say it could only help because if you're adding a little bit of supplement in, it's kind of like you're adding a little fertilizer in. So um, it could potentially boost your response.
And then some questions were just about, is it okay to have Fraxel or laser work done on the same day as full therapy? Are facials something you would discourage, or would that be safe for patients to have a facial done on the same day? Just same day treatment options.
Yeah, so you actually can do laser and Ultherapy on the same day. For example, if you wanted to do Ultherapy and Fraxel on the same day, I would recommend we do your Ultherapy first and then your Fraxel. Um, Other lasers sometimes that we do with it, IPL or V-beam can be combined as well. As far as a facial, I think it's fine for you to have a facial after Ultherapy.
There was a quick question about if Ultherapy has any benefit for acne or acne prone skin. Is there any kind of information there?
Yeah, well, therapy is probably not going to be your best treatment for acne related problems. However, I could give you a whole other presentation on that. So, if you do have questions about acne, we can do a consult on that.
Another similar question was if Ultherapy is safe for melasma.
Yeah, old therapy is safe for melasma. The good part is we're going deeper than that layer that the melasma typically sits at. So I've never seen melasma flare with old therapy.
And then we had a handful of questions just about age and how that factors in what kind of results we're seeing from someone who's in their 30s versus someone in their 40s or even in their 70s, what results we
Yeah,
kind of see.
I think therapy can be beneficial at any, age, depending on, other factors like have you done any other treatments before can make your results a little bit variable, but it still can be beneficial at 70. When you're in your 30s, a lot of it is like getting ahead of the game, which is great. Um, but I think therapy can fit into many patients' treatment plan and can be a great alternative if you're not wanting to do, a surgical procedure.
We had a question about the sensation of Ultherapy during treatment, what that feels like, and I think another reminder about the pain management option.
Yeah. So, I've had therapy several times now. I think it feels kind of like if someone was thumping your skin over and over again. So it's the repetitive nature of it, and then sometimes near bone or certain nerves, it can be a little sensitive. Um, I think the Pronox laughing gas, it makes a world of a difference. If you do feel like you're someone who's more pain sensitive, we are happy to, give you a special little, we have a little cocktail of medications we can prescribe, and then you just bring it to the office, and then you would need to have like a friend or family member drive you home, but those can make it really easy for you.
And then one last question about fat loss in the treatment areas. Is that something to expect, or any info on that would be helpful?
Yeah, so it really all comes back to looking, um, at the ultrasound screen. Um, I will say therapy, you know, you have to know what you're doing. You have to be good at ultrasound imaging. I'm very well trained. I've been in the therapy studies, so when you're utilizing that technology appropriately, fat loss does not occur. So you know which layers you're treating. You're treating your collagen layers, not where your fat is lying. These are all really good questions. Anything else, Becca?
It looks like there's just a couple more questions. One last
Okay.
one is about if
Yeah.
someone has had Kybella to a treatment area, is there a time frame they should wait to have Ultherapy done to that area, or when can they begin?
Yeah, I would say if you have already had Kybella, I like to give it 8 weeks to let that swelling settle down that can occur with Kybella. And then I would encourage that person to do like a consultation with me so we can kind of assess like, do you need more Kybella or are you ready for therapy? Because that's kind of a matter of, are we trying to target more the excess adipose tissue or are we ready for skin tightening? So that would be a really good case where, hey, let's do an individual consult, a one-on-one.
Great. And then the last question we have is just about pricing and how patients can get their pricing and um, when they need to book again as a reminder.
Yeah, sure. That's a great question. So pricing is per like area on the face. So if you call, one of our receptionists can go over pricing with you. You can also email us at Wood Team, where myself and Becca and my other assistants can kind of go over that with you. And again, you will get 20% off a treatment if you book by Valentine's Day. Um, and then you'll just put your deposit down and then we can work with you on scheduling that. So it's just getting that appointment set by Valentine's Day, um, so that you can take advantage of this great special, because it's like a great opportunity to take advantage of Ultherapy. I do this special just because I think it's a great treatment. I want my patients to be able to take advantage, and I just appreciate you all joining me. So I want to thank you for that. Is there anything else, Becca? Did I explain that well on the booking process?
Yeah, that was the last main question there. And
Okay.
I'll also be reaching out to everyone who attended just to check in and see if there are any questions y'all have once we get the list sent over. But that's it.
Great. Well, this was so much fun. Thank you all again. Don't hesitate to reach out. We're happy to, answer more individual questions if you have any. And again, this is the link online that you can book. And then these are the numbers to our Westlake and Marble Falls offices, um, where I practice, and you can book your treatment. I hope you all have a fantastic evening. Thank you again.